Today we are discussing about MCT, that is mast cell tumor. Mast cell tumor. So it is again round cell tumor. So basically it is a round cell tumor. So if we talk about mast cells are basically basophils. When they are present in blood, we call it as basophil. When they are present in tissue, we call it as mast cell. So these are round cells. So we call it as round cell tumor. So in previous class I discussed the TVT. What is the difference between MCT and TVT? So in TVT we discussed about the vacuoles, white vacuoles. But in mast cells we see round nuclei, and we see the basophilic granules. So these are the granules, basophilic granules, which contain histamine. So what is the role of histamine? So it can produce allergic signs like itchiness, running nose, sneezing. So these are allergic signs. So why these happens in our body? Because of histamine. So that's why these cells increase in the allergy. So when there is degranulation of these cells, that will lead to histamine release, and it will lead to histaminic signs like ulceration in the GIT. Because if you know why there is a gastric acid production, because of histamine. So next we talk about the cause of MCT. If we talk about cause of MCT, it is complex. Multiple risk factors are responsible for cause of MCT. Very few tumors are there which have single pinpoint cause. Most of the tumors have complex, multiple predisposing factors. So one of the reason of MCT is genetic cause. So next we talk about clinical signs of MCT, mast cell tumor. So clinical signs we talk about, there is ulceration in the GIT. Ulceration, very important sign. So that leads to vomiting. It may contain sometimes blood, right? And you may see the sneezing, itching, running nose, or we can say. So these are the signs. So MCT, mast cell tumor. Most of the mast cell tumors, they are malignant. Most of the MCTs are malignant. So they mostly present as a nodule on the skin, and people just most of the vets, they simply remove that tumor without actually confirming what kind of it is. So basically grading of tumor is very important. Grading. So there are three grades of MCT: grade 1, grade 2, grade 3. So high grade tumors, they have potential to metastasize. So how we grade them? We take a biopsy. We take biopsy, right? So based on FNAC or cytology, we just tell that it is MCT, mast cell tumor, but we don't confirm its grade. So sometimes high grade tumors even doesn't metastasize. So sometimes it happens, high grade tumors don't metastasize, but there is high chance that these tumors may lead to metastasis. So next point is diagnosis. So diagnosis is, again I told you, it is a round cell tumor. So you see a round nuclei, and you see a basophilic granules. Basophilic means bluish in color. So this is the identification. FNAC, you can use FNAC, fine needle aspirate. You go for biopsy. Biopsy is confirmatory. Sometimes tumors are poorly differentiated, and on FNAC or on cytology, you can't say that it is MCT. So it happens many times. So biopsy is confirmatory. So next we talk about prognosis. Prognosis. Outcome of high, obviously higher the grade of tumor, poorer the prognosis, because it has potential to metastasize. Uh, Prognosis, less favorable prognosis depends on three factors, mainly three factors. Less favorable prognosis, less favorable means lesser survival time. So it depends on कि a predisposed breed is affected. So some breeds are predisposed to this tumor. If though animal affected is belongs to that particular breed, so there is less favorable outcome, right? So another factor is grade cell proliferating stage. That is called, we can call it a mitotic index. Mitotic index is what? Mitotic index is actually defines the mitotic figures. Mitotic figures are rapidly dividing phase of the cell. So higher the number of mitotic figures in the sample, lesser will be the higher will be the grade of tumor, lesser will be the survival. So coming to the treatment part. So treatment is what? Treatment, if there is low grade tumor, you can opt for surgery. But if it is high grade tumor, then surgery plus chemotherapy. So sometimes tumor complete surgical removal is not possible, so we can add radiotherapy, or sometimes tumor is on that location where surgery is not possible, or so in those cases we add radiotherapy. But in our conditions, this facility is not available, but we can opt for these options: surgery and chemotherapy. Thank you. Okay.